If you'll humor me, I'll tell you, personally, and then if you would, we'll walk through kind of from the CMO lens how we ended up where we are today, and very excited about it. In 2014, after being in clinical practice for a couple of years, I started taking over our research locally at my site and really, really started to enjoy it. Understood that this was a passion of mine. One of the really big difficulties was I had to continue to practice medicine and make sure that my patients stayed the focus of my day. And we know that there's an increasing number of chronic disease patients in GI with a decreasing number of GI physicians. And how are we going to scale one of the most sophisticated pieces of comprehensive care with what I just mentioned happening in the background? And so I started talking to different folks and asking them how they did research. What did you do here? Let's compare notes. And I found out that we were all doing it a little bit different, which was exciting because there was opportunities for me to improve. But when you flip that over and you look at it, you go, wow, we've all taught ourselves how to do research out of necessity for our patients, which is the right thing. But, as we know, variability can be the most difficult part of scaling something that's successful. And so years down the road, about 3.5 years ago, I had the opportunity to participate as the CMO for GI Alliance and took over research about 2.5 years ago. And now really had to think about it on scale. Like, all right, Casey, what are you going to do to help physicians with that big question, which is focus on patients and allow the most sophisticated opportunities for clinical research to be part of patient care every day? And we poked around in the market a long time and we looked to see what we could do to scale. And we found some really, really smart people. It's just so happens that John had been looking around and putting together a team of very, very bright people for a lot longer than I had been looking. And seems as though he had taken most of those and put them on the team of Iterative Health. And I realized that, well, I think if we put our forces together and the synergies of 1+1 = 3 would be what we wanted to do. And so that's where we started down the journey about 1.5 years ago of wondering what we could do to work together. And here we are today with really an opportunity in a market that is very hungry for, I think, a partnership that we have put together to help pull these assets to market and ultimately increase and overall improve the clinical care for our patients at the bedside.